Client experienced increasing sharp stabbing pain over 4 months in the lateral and medial epicondyle areas, pain along the right forearm radius side proximal to distal, wrist pain, and occasional tingling or numbness of fingers. Begin by checking for active and passive range of motion, looking for full extension and full flexion. Supporting the back of the upper arm, provide overpressure to the forearm while the client resists elbow extension. Similarly, provide underpressure to the forearm and have the client resist elbow flexion. Repeat with the wrist in prone position, which is not shown, and repeat the whole sequence with the arm in full extension. Check for range of motion and pain in active wrist pronation and supination. With the wrist in neutral position, have the client supinate and pronate against resistance. Check for pain. Check active wrist flexion and extension. Use both the pronated wrist position and also the supinated wrist position. Clinician supports the arm. Clinician applies pressure while patient attempts to resist wrist flexion. Check for pain in the lateral epicondyle region. Clinician supports the arm. Have the client flex the wrist. Clinician applies pressure while client resists wrist extension. This is a check for any pain in the medial epicondyle area. Again, supporting the arm from below with the client's arm at full extension. Clinician applies some gentle pressure to passively stretch and extend the client's wrist. Note any pain in the medial epicondyle region. Again, supporting the arm from below with the client's arm at full extension. Clinician applies some gentle pressure to passively flex the wrist. Check for lateral epicondyle pain. Again, supporting the arm from below with the client's arm at full extension with fingers extended. Clinician provides resistance to the extension of the third finger. Note any lateral epicondyle pain.